Yes, sir. It's visible,
This
sir.
meeting is being recorded.
Should we start, Vinayak?
Yes, sir. Yes, sir. We can start, sir.
Okay. Good evening, everyone. Myself, Dr. Ajay. Uh, I am a urologist, and now Dr. Vipin was very known to me, and he has requested for a class. So, and I am very much delighted to take this class on urology. My classes will be uh, uh, of basically concentrating on the NEET SS pattern, and it will be divided into 3 to 4 classes. So today is the first part of the same. It will be urologic basic, and the second is kidney and ureter. Start with the class. This is all we have seen this movie, and the Akshay Kumar is like very much confident कि जो मैं बोलता हूँ वो मैं करता हूँ और जो नहीं बोलता हूँ definitely करता हूँ. So this also same applies to NBE. So NBE what he does to they does to us every time. They change pattern every time. Sometimes they keep urology 100%. Sometimes they keep general surgery 100%. And they tell it us this 30 or 40 days ago. So this is completely unpredictable, and we should not divert our mind based on this, and we should focus on our study, focus on the basics of general surgery, focus on the basics of the subspecialties like urology and general GI surgery and oncosurgery. So that will help you not to divert our mind for this type of change, immediate change just before the exam. So the main textbook one should refer for urology is Urology Campbell. But for a general surgeon, reading urology just for clearing NEET SS exam is too hard and too long. And one cannot afford just for a 7 or 10 patient to go to the urology part. So I cannot base my class based on urology Campbell. So what option other we have? We have Love and Bailey, which is a standard textbook. We have Sebastian and we have Schwartz. So what I have seen through my exams and the recent papers that they are particularly more focusing on general surgery basics. So the basics are more clearly and deeply given in Love and Bailey. Okay, and sometimes the MCQ are totally 100% based on Love and Bailey. So today's my topic and my presentation, and afterwards also my presentation. 90% of presentation will be all from Bailey and supported by Sebastian and Schwartz. Nothing extravagant, I will say, beyond these 3 books, because these 3 books are very important for NEET assess, and these are the things only you need to go through. Right. So now starting with the topic, uh, urology. There are many topics given in the Love and Bailey, around 6 chapter of them. I will go through, and then it is combined with that Sebastian's chapter and Schwartz chapter. So what is urology? Urology basically a retroperitoneal organ of retroperitoneal surgeon. Urologist is a retroperitoneal surgeon. Urology deals with retroperitoneum, pelvis, inguinal region, and the genitalia. Hello.
Yes, sir.
Vinayak, everything looks fine, na?
Yes, sir. Yes, sir. Everything is fine.
Okay. One second. Give me a second, just. What urology and general surgery shares common things. So that are trauma, that is retroperitoneal or intra-abdominal trauma that may present in a similar situation in which urologist and both general surgeon may work together. Another is the pelvic malignance neoplasm, in which complicated pelvic surgery may lead to injury of ureter, bladder, in which intraoperative assistance of urology and some urological knowledge is important. And management of iatrogenic trauma, which is important and for surgical injuries. And challenges of necrotizing fasciitis, that is spontaneous gangrene of genitalia and perineum. These all topics also make it important for MCQ purpose. Like trauma is important, iatrogenic injury is important, and necrotizing fasciitis is obviously an important topic. So starting with the basics, that is the urology anatomy. Although adrenal is not a part of urology, but it is a part of ectopic. So it is mentioned in the Sebastian that about the anatomy of adrenal. So I have considered it in my PPT. So adrenal, as we know, it is a primarily endocrine organ, and it is the most superior aspect of the ectopic, and it is a small and paired organ. It lies within the gyrus fascia. Suppose this is a kidney. Okay, kidney is surrounded by one fascia, tough layer of a fascia that is called as gyrus fascia. So what we know is gyrus fascia is covering kidney, but that is not true. One layer of gyrus fascia is also involving the adrenal. So this is the gyrus fascia, right? So gyrus fascia also involves adrenal. That we have to remember. So it lies within gyrus fascia. It has the orange yellow appearance and an area of 3 to 5 centimeter in transverse diameter. So adrenal, as we know, has a two part. One is cortex and one is medulla. So this is suppose sorry. So suppose this is the adrenal. Okay, so it has two parts. One is cortex and one is medulla. So cortex is the outer part and medulla is the inner part. So both the part has got different origin. Cortex arise from the mesoderm and medulla arise from NCC, that is neural crest cell. This, this is important for MCQ purpose. Cortex from mesoderm, that is mesoderm and medulla from the NCC, neural crest cell. And this makes also a particular feature of catecholamine secretion that I have said I will tell in later slides. So the cortex has basically three parts, that is glomerular, fasciculata, and reticularis. So from outside to inside, cortex is GFR, glomerular, fasciculata, and reticularis. And this GFR, each layer secretes different hormones. So glomerular secretes mineralocorticoids, this fasciculata secretes glucocorticoids, and reticulata secretes sex steroids. So that is every drug we call mg, milligram. So that is mgs, GFR, mgs, milligrams. Okay, G, F, and R. So that is the shorter way we can remember. Glomerulosa, mineralocorticoids, fasciculata, glucocorticoids, and reticulosa sex steroids. Uh, Now medulla, I have told no, that medulla arising from NCC, neural crest cell. So it has a particular characteristic that medulla is innervated by sympathetic fibers. As we know, sympathetic fibers are part of autonomic systems, and the ganglions of sympathetic fibers are always situated on the organs. But here is the difference. In medulla, there is no ganglion. So it is only a presynaptic sympathetic fibers. It is not a synaptic fiber. It is presynaptic, not a postsynaptic, and it secretes catecholamine. So the arterial supply of the adrenal, it comes from three ways. One from above, one from medial side, and one from downward side. From above, inferior phrenic artery supplies the adrenal. From medial side, abdominal aorta supplies the adrenal, and for inferior side, ipsilateral renal artery supplies the adrenal. Venous drainage also from the both adrenal are different. On the right side, the on the right side the adrenal drain into vena cava. On the left side, it drain into the left renal vein. Okay. So these all are the important for MCQ point. Sorry, my throat is like not well today, so I am having repeated cough, but I will try not to disturb you more and continue the lecture. So this is the adrenal, this is the diaphragm, this is the aorta. Okay, and this is the kidney. So it is a three supply. One from diaphragm, that is infradiaphragmic inferior phrenic artery. One from medial side, that is from aorta, and one from inferior, from the ipsilateral renal artery. And venous drainage, on the right side, it is directly into vena cava, and on the left side, it is in the left renal vein. Relation of adrenal on the right side, anteriorly, it is related to vena cava. Anterior-medially, and it is also related to liver and duodenum on anterior aspect. And on left side, it is related to pancreas, and also the left upper pole of kidney is also related to pancreas, and the part of adrenal on the left side is also related to adrenal, related to pancreas. Sorry. Uh, right adrenal is superior in compared to the left adrenal. Here is the point. Okay, so what we know is about kidney and about adrenal. Okay, so left kidney and right adrenal. Left side kidney is superior than the right side, and the right side adrenal is superior than the left side. These both things are very much controversial. I will make you understand these things in detail in next slide only. But remember, left side kidney is superior, but not adrenal. Adrenal is superior on right side. So here is the image. Here we can see adrenal gland. This is on right side. Okay. So right side here we can see adrenal is related to vena cava. This is a vena cava, very close relation, and also arterial supply from the vena cava. And this is the lower arterial supply, and this is the upper arterial supply. Okay. And this is the adrenal gland. On the left side, this is the left side image. So it is related to upper pole of the left kidney, and the vein is draining into the renal vein, and the arterial supply, as we can see here, is this. Okay, so what happens is the kidney is like that on the right side, and on the left side it is like that. So this is suprarenal, it is above the renal. So right side it is called as suprarenal gland, and the left side it is adjoint to renal, that is at the renal. Right? So red adrenal on the left side, suprarenal gland on the right side. So suprarenal, obviously there is something that is superior to renal, will be more higher up than the another side, which is adjoint to renal. Right? So this side is right side is superior than the left side. Understand? So here again, right side adrenal is superior to the left side adrenal. Arterial supply, superior, medial, and inferior. I think there should be no doubt regarding this. Inferior phrenic artery, which is the first branch of aorta in abdomen. This is also an MCQ. Okay, first branch of aorta in abdomen is inferior phrenic artery. One of its branch is also supply the adrenal as a part of superior supply of adrenal. Now coming to the first genitourinary organ, that is kidney. So kidney is a pair organ, lie in the retroperitoneum, just like adrenal, and it is the left-sided kidney is larger than the right-side kidney. It sits up higher, and the size of kidney is approximately a size of a closed fist of that person. That is the approximate idea about the kidney. The left kidney is higher and larger and higher than the right side. And the superior pole is has a more width than the inferior pole. This is also in MCQ. It is not that both pole are symmetrical, but the superior pole has more width and the inferior pole has the less width. There is a statistical significant correlation between the renal length and stature of the patient. As the uh, stature of the patient becomes tall, the kidney length may vary between the tall and short person. So kidney lies obliquely or the psoas muscle in the retroperitoneum. Uh, its superior pole compared to inferior pole lies medial. Here we can see that this right side kidney, the superior pole lies medial to the inferior pole, and it is posterior than the uh, inferior pole. So superior pole is medial and posterior. So both pole are not same. It is tilting toward the midline and backside. The upper pole is tilting toward midline and backline. So kidney lies obliquely over psoas muscle, and the superior pole is medial and posterior. This is important concept which will help you to solve many MCQs which will be asked in exam. And this type of basic MCQ what NEET SS pattern is asking recently. Okay, it looks basic, it looks easy, but many of us keep our concepts wrong, and we do them wrong. So the person who is setting up the NEET paper is asking similar types of question every time. As the kidney is rotated outside, this kidney is rotated outside, right? Because of the psoas muscle. So the hilum faces anteriorly. Here we can see this kidney is rotated outward and hilum is facing anteriorly, right? So hilum is rotated anteriorly and it is angled 30 to 50 degree with the horizontal plane. So this is the 30-degree plane that is hilum is making with this. And lateral border, this is the lateral border is rotating posterior. So each and every point in this slide is very important. Kidney lies obliquely over the psoas muscle. The superior pole is medial and posterior. Remember, superior pole, medial posterior, lower pole, lateral anterior. Superior pole, medial posterior, lower pole, lateral and anterior, and the hilum rotated anteriorly, making the plane between horizontal plane about 30 degrees. And lateral border is rotated posteriorly. Now coming to coverings of the kidney, there are two coverings of the kidney. One is tough layer, that is two fibrous capsule of the kidney, and another is the renal fascia, that is xerota fascia. So xerota fascia, this is all the xerota fascia I am drawing. Okay, in this figure, this is all the xerota fascia. And this red color thing I have drawn is the two capsule. In between these two, there is the adrenal also. This is adrenal. As I have said, xerota also involves also incorporates adrenal, and the xerota fascia here it is open. Downside it is open. Just remember this. I will tell it later on. So, renal fascia, it covers kidney from anterior, posterior, and all direction except inferior. As we have seen that there is no inferior end. This is inferiorly, it is open. So, xerota fascia covers the renal kidney anteriorly, posteriorly, medially, laterally, superiorly, but not inferiorly, right? So, Uh, Xerota fascia divides retroperitoneum into three parts. First, the part which is above the xerota fascia, right? So above the xerota fascia, and this is the peritoneum, right? This red color is peritoneum. This is xerota fascia. So in between this is preperitoneum. Okay, so that is anterior pararenal space. So it is continuous across the midline and contains ascending and descending colon, duodenal loop, and pancreas. Perine, sorry. This space is anterior perirenal space, which is outside the xerota. Here is the colon, suppose. Okay. So it is the anterior perinephric space, which is continuing on the opposite side also. It crosses the midline and contains ascending colon, descending colon, duodenal loop, and pancreas. The space in between these two layers, one and two, these two layers, it is called intermediate perirenal space, right? And the space posterior to this, it is posterior perineal space. So Gerota fascia divided the space, our retroperitoneal space, which is this is the peritoneum. This is the retroperitoneal space. The whole is the retroperitoneal space. This whole is the retroperitoneal space. So Gerota has helped us to divide it into three parts. One, it is outside Gerota fascia anteriorly, that is anterior perineal space, which which is inside, one which is posterior. Okay, so perinephric fat is wider than the colonic mesenteric fat. This will help us identifying perinephric fat and colonic fat during the laparoscopic surgery. Now, as I told that covering of Zerota, it laterally the two layer of Zerota, that is anterior and posterior, both layer of Zerota fuses behind the ascending and descending colon. So it envelops kidney from uh, 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 anteriorly, posteriorly, and fuses laterally. Medially, the posterior layer. Medially, there are both two layers, anterior layer and posterior layer. The posterior layer fuses with fascia of spinous muscle. So laterally, the anterior and posterior layer laterally will be fused. On medially, the posterior part will be fused with the spinous muscle, and anterior part will be merged into connective tissue of the great vessels like aorta and inferior vena. Okay, so and it will be open from the inferior side. So why this Zerota is so much important in urology? So it provides a natural barrier to help tamponade bleeding, like in renal injury and in post PCNL hematuria. This natural covering helping us to tamponade the bleeding and may provide renal and hemodynamic protection in case of renal trauma and spontaneous renal hemorrhage. Okay. Also, it provides tumor invasion into surrounding structure in case of renal tumor. So basically, it is acting as a barrier for any infection, for blood, or for tumor. So relation of kidney to other structure. This is basic what we have studied in anatomy first year. Okay, so I will go through fast through it. So anteriorly, right side of the kidney, and this is left side of the kidney. Right side of the kidney related to duodenum on the medial part. On the inferior part, it is related to this ascending colon, and on superior part, it is related to that adrenal. Here we can see this is the adrenal, and on the superior part is also covered by the liver, part of liver. Okay, so one maneuver which we need in nephrectomy for right side is Kocher's maneuver. Okay, we have all studied general surgery. What is Kocher's maneuver? So during the right nephrectomy, to a system of kidney, we have to do Kocher's maneuver to lift the duodenum up from the hilum and to dissect the kidney further. Okay, on the left side, the descending colon is in relation to posterior and lateral surface of the lower pole. Also, the part of pancreas is related to anterior part. The spleen is related, and the adrenal is related. Okay, so these are the basics organ which you need to know, which are related and not, and especially surgical anatomy associated with that.